What do we do for a child who's an infant, right? They're not completely developed, their brain's not completely developed. There's security in being swaddled as an infant. And so doing that for a brain, someone whose brain, right? Physically, my son's 24, developmentally, his brain is still a very young brain. And that feeling of being swaddled makes him feel secure. And so having that opportunity at the dentist where we've given him a chance to go sit in that dental chair without that board there, and the board is standing in the corner of the room, he'll walk in that dental room, he'll look at that chair for the board, and if he sees it on the wall, he'll go get it and bring it to the chair. I can't find dentists, I've got one now, who will feel comfortable enough offering that to my son. There's consent, I get it. It needs to be used properly, but it's such a wonderful safety mechanism, not just for him, but for the people who are providing his dental care. And we have successful dental visits. So that piece is just one little tiny piece of learning and opportunities to learn how to support this population that could change their lives. And I worry now that he's an adult.
That's called medical immobilization and patient stabilization. And it is exactly as you describe it, a swaddling that prevents the hand from coming up and grabbing at the dentist or staff. And when I trained, I hate to say nearly 40 years ago, we used to have caregivers laying on legs and holding hands and things like that. This is a very different approach where it's explained to the individual, it's explained to the caregiver, and we actually have the ability for the caregiver to watch if they wish, but it just holds them in position. What's remarkable is so many patients actually, as you describe your son, look forward to this as an item. Some providers would rather use a chemical immobilization. We're going to sedate your child and manage in that fashion. This is another tool that allows us to be able to routinely visit with the child, with the adult even. Your child is 24 years old. That's a remarkable ability to be able to get the person to have comfort. It's one of the things we do teach. We do teach the nuances of using the medical immobilization.
I've had it done to myself, and I think once maybe there's an opportunity for a parent to be able to lie there and see how comforting it feels and recognize how much more comfortable and how much less risk there is to a chemical.
Sedation, general anesthesia always has a risk, especially in so many of these individuals that are taking multiple medications and have multiple medical conditions, heart conditions, and other items. It is both a risk, it is a time consumption, and one of the problems I have with it is it's not a method of maintaining health. It's a manage of fixing, general anesthesia and sedation are methods of fixing an acute problem, taking care of gum health, taking care of tooth decay requires frequent visits and fluoride treatments and cleanings and things like that. We need to desensitize and accommodate.